Hello, my name is Mark Newkirk with iFishent, and thank you for joining us today for a FireFly side chat with Drs. Periman and Schachter. Before they begin a 15-minute raw, unscripted discussion on FireFly and how it benefited their practice and also how maybe it'll benefit yours, I want to take a brief moment to introduce you to the FireFly. The FireFly is a complete digital slit lamp that is not only just an imaging device, but can also be used as your daily driver slit lamp in your exam room. But it comes with the slit lamp and all of the imaging hardware needed and also the software to complete the system. This system does allow you to do several different modalities, the first being color still photography. So as you can see, you can capture very high definition, high resolution color still images. It also has an integrated Ratten filter that you can use to enhance your corneal staining. It does enhance it for you, but also for video purposes and for showing your patients either normal corneal staining, that it will enhance that, but it also, you could record a video of maybe tear film breakup time or something in video. So there is a lot of uses with that. You have obviously video recording, and thanks to our auto exposure and auto parfocality system, that you're able to, if you want, go live and record your full exam and then go back and review that video completely with the patient, or scroll through it, show them parts of the video, or even capture stills out of that later to save and archive. So it's great for doing your video recording. In the software, you just select an IR button. The IR button switches to an infrared camera and an infrared light source, and allows you to capture high definition, very sharp, detailed mybography images. And that's nice on the slit lamp because you can use different magnifications and capture that in still and or video. And then you can also select an area of the lid, and it will do an automatic gland analysis using AI to give you a enhanced image to show the patient, but also give you basically a number, put a number to it, give you a grading scale. Below, you'll see there, this system's also used during the masking probing procedure. And you can kind of see a little bit of that there, but that's really a cool use for our mybography on the slit lamp. There's now an optional dry eye attachment for the FireFly that has two different light sources that allows you to capture non-invasive tear film breakup, automatic non-invasive tear meniscus height measurements, lipid layer thickness, mybography, eyelid margin, AI analysis of the bulbar redness, and also your fluorescein staining. It then takes all that data, puts it together into a dry eye diagnostic report that you can show the patients. Both eyes presented together, shows the normals and where the patient is presenting themselves. Well, that's the brief explanation of the FireFly. I invite you to go to our website at ifishent.com or contact us. And please, if you're interested, set up a time with us to do a quick online Zoom demo like this, and we'll show you with a live patient, go through the hardware, show you the imaging, and show you the software and answer any questions you may have. Otherwise, thanks for your time, and enjoy the little discussion ahead. Thank you. Take care.
Welcome. I guess we are up. Is that right, Laura?
We're live. Hi, everybody.
I was waiting for some big announcement or something, but it's just us. So welcome, everybody.
And now I present to you Scott Schachter from Pismo Beach, California. Yeah, the crowd goes wild. How's that for an intro?
There you go. And you, of course, need no intro, Laura. So we're just going to talk about FireFly for 15 minutes today. And I'll tell you, I do a lot of speaking for a lot of different companies. I don't speak on behalf of FireFly. They are paying us to do this program, but I'll say I mention the FireFly at almost every dry eye talk that I do now, because it's really changed my practice. I've had anterior segment imaging before, but I've never had anything of this quality, ease of use in terms of capturing images, and then the patient education aspect has been phenomenal. How long have you had a FireFly, Lauren?
Well, I got it right away after I opened my clinic cold in the middle of COVID. I opened June 5th, and my first purchase was the FireFly system because of those very things you mentioned. Ease of capture, I can get it in real time, patient education, demonstrating progress, diagnostic features, all that stuff.
Right, and this is not just an image capture system. This is an entire turnkey unit, correct? Right?
Yes.
Yes. It's a very nice slit lamp, hog strike style, right? And it's got all the imaging built into it. So I'll tell you what has changed for me. I'm currently involved in some research, and corneal staining is part of that. And I've always had the cobalt blue filters, and I thought that's adequate. And I didn't use a Ratten filter very much, but a couple things. First of all, I always like to acknowledge Bill Troutler for pointing out to me the necessity of waiting a minute or two after you instill fluorescein to look for dye. And then next, the filter built into the FireFly finds staining that's very difficult to see otherwise. Would you agree?
I heartily agree. And not only the built-in Ratten filter, so it's one less thing to coordinate. You just pull up the little lever and the filter drops into the view path, and it just highlights everything. And I'm able to connect it to my video screen on the computer right next to it. That's the system over there. There's the FireFly, and there's the computer screen. And my fellow, I have a wonderful fellow, Dr. Sathi Maiti, M-A-I-T-I, she's amazing. We're able to observe the clinical findings together on our clinical trials patients as well. So, and I can capture a picture, and we can double check each other on counting the staining. It's awesome from the visibility standpoint, but I love the optics of it as well. Like some slit lamps are kind of a narrow field of focus or just a little wonky to use, but I love the wide field that I can work with. So when I do little procedures like mask and probing or epilating lash for Demodex count, which is sort of strangely fun, or expressing that meibum in the toothpaste patient, and then watching it turn into olive oil with our advanced treatment series, the IPL series, and then showing that video to the patient of their improved meibum expressibility. It's like there's a little celebration between Raquel, the technician, Dr. Maiti, myself, and the patient.
And a great point you make about ease of use. What you see is what you get. So it's not a matter of having to adjust. If you're looking through the oculars there, that's what's going to be on the screen. And during COVID right now with mask wearing, I find that very useful to not have to be right up there. So, I mean, even if you're using it for example, with an indirect at 90 or 78, you can back away and not be fogging up that. Now the patients might fog it up, but the videos, the photos are great, but the videos, right? When I can show a patient a tear film that falls apart within 2, 3, 4 seconds, it's very irregular. In addition to me, that helps me drive compliance when I'm doing in-office meibomian gland expression or talking about IPL. I can say, listen, here's what these glands are, here's what they do, and the net result, this tear film, imagine your vision when your tear film's breaking up like that.
That's right. And I totally agree with you. And like sometimes you'll see that tear film break up right through the middle of the visual axis, or you'll see epitheliopathy and anterior basement membrane dystrophy right in the middle of where they're trying to look. And it's a helpful thing for communicating with the patient. If like, I see your problem. I see what you're telling me about the quality of your vision. Take a look. And they're like, oh, wow. But then you can go back and look at some of the prior images and then show them their improvements. And that's really fun too. And that, I think, enhances adherence to therapy even more.
What are all the features that you use? We have a couple of meibographers. Sometimes my staff's busy. We run out of time to do that. And I'm using the meibography, which is not going to be as good as a meibographer. However, for patient education purposes, it can be pretty useful in a pinch. What are you using it for?
So I use it for my general exam. That's my main slit lamp. I use it to examine every single patient. I use it to capture listening green staining pattern, lid wiper epitheliopathy, conjunctival concretions, Yeah, I even used it recently to help a woman understand the role of her floppy eyelid syndrome and her dry eye. I had a photo of her looking down. I had the lid pulled back, and there's lacrimal gland herniation and papillary reaction under there. And it was like the camera was able to see way down deep in there. So that would help with the patient communication on educating about the disease. Like, no, you really need a sleep study that's positive, and I'd be surprised if it isn't. We need to treat it with CPAP, et cetera.
Yeah, I had just
So we use it for video too. Yeah.
Just last weekend, I had a patient who had this foreign body sensation in one eye, and she thought it was due to her sclerals not fitting correctly. And I actually got to show her as I pulled a cat hair, a pretty long cat hair out of her inferior fornix. Like, that's always kind of gives me chills a little bit when I pull that long hair out of an eye. But there's problem solved. There you go. There's
oh, and you're a hero. I love that.
Yeah.
Yes.
So
and you can use it to help patients monitor their response to home therapy with Demodex control as well. So we're able to get baseline photographs of Demodex, which is, I think, really underappreciated. And it just is highlighted so beautifully when you simply ask that patient to look down. It just like highlights the Demodex load against the upper lashes. And then you're able to show them how well they're doing with their in-office therapy. We do Zest. We do IPL. We published a paper showing that you can just kill Demodex with IPL, kind of nefariously satisfying. And then home maintenance with new lids and ZocuShield. And it's so cool to be able to show them how well they're doing in some cases that they need to step it up a little.
Right.
In general, they're doing better.
You mentioned look down, which I believe is going to be the catchphrase for Tarsus with their new Demodex drug in the works. And similarly, since Upneek has come out, I've actually used it for before and after pictures of how much of that upper lid is showing. So you pull back, way back on the magnification, put a drop of Upneek in, checking back a few minutes later, and you can see that just kind of disappear. So as these innovations come around, it's really important for education. Oxervate's another one that where I say, look, you've got this persistent central epithelial staining. And, I talked to you about this before as an ACPEX study showing that if you have corneal staining, you read slower and you see freeway signs later. And if I can pick up that staining that I might otherwise have missed, honestly, even with my cobalt blue filter, I was missing it on several. The Radon filter sadly at this point in my career, I'm finally figuring out the value of that and how much more corneal staining.
Me too.
Yeah,
and I think that's the point is we're continually learning. Like you and I have been doing dry for a long time, and we've done a lot of programs together. It's so much fun. And I just feel so lucky to be your friend. But it's continual learning. Like we've got all these cool innovations coming out on the fore, and just being able to visualize what's going on and measure the impact of the intervention that you've prescribed for your patient is powerful.
Yeah, it's you and I run a Facebook group called OS Docs. Join it if you haven't. It's a great professional group, about 6,000 non-industry group, and it's non-snarky, non-professional. If it is that way, we're going to kick you out. But more than ever, since I've had the FireFly, I've been posting, on some of my social media or Facebook group and getting opinions from people or showing, oh my gosh, look at this staining, how quickly Oxervate took care of that, or how much better my patient looks after this Zest treatment that we did, even showing a patient a foreign body removal. And on top of that, from a business standpoint, of course, this is a billable procedure. I don't recall what I paid for this, but I believe it was very competitively priced considering it's turnkey.
And you have to buy a slit lamp anyway, right? If you're just getting started like we did with 200 square feet and a slit lamp and an IPL, you need to buy one anyway. So at least you've got a compact all-in-one image capture. I've got it sitting right next to my Antares, which is an awesome mibomographer, videographer, topographer. So I've got this all-in-one suite with just a very small footprint.
Well, I do find it's just very easy to use. I have the Goldman. Do you have the Goldman attachment for yours as well?
I did get that. Yep. So I could check IOPs. Yep.
Right. So it's a very easy to use slit lamp. It's high quality imaging. Again, these are billable. It's great that we get all that, but there is a code, of course, for anterior segment imaging. and it's not a high paying code to my knowledge, but just the same, it's not a super expensive piece of equipment. And the patient education, I've got an OCT and an Optos, and I've got all these images that we can wow patients with, but anterior segment far and away, this has just been a real pleasure. It's a real joy. It's just something I look forward to. What can we find on your slit lamp today that might be surprising? And patients love that education, right? They love to be able to see what's going on with me. They're always staring at the images when I walk into a room.
Right. And I'll even turn the screen, the computer screen that registers the images, and I say, would you like to take a screenshot to show your friends? They're like, oh yeah, they get the phone out, they snap a picture.
Definitely. You can email these images to yourself relatively easily. So the whole thing, the database management, the ease of use, all of that, I've been real happy with it. And like I mentioned before, Jenny Drake and I did a talk last night about driving compliance and in-office conversions for procedures. And this plays a big role. That imaging, you can explain to patients, like they say, picture worth 1,000 words, probably worth more than 1,000 words. So there's a lot of value in being able to show your patients what's wrong to get them to buy into your recommendations.
Yes. And as you and I have talked about many times before, to be a dry eye doctor, you have to look, you have to listen, you have to think, and you have to feel. And this gets you one step closer to doing all those things and going on your way to being a great dry eye doc.
Yeah, you're the best listener I know. And you've seen patients in my practice when you trained me on my IPL, and your way with patients is unsurpassed. Patients love you. They came to love you within my office within minutes. You really, you're essentially an empath, and patients catch that from you. You know what they're suffering through. So I highly recommend it. Again, I've talked about FireFly in almost all my dry eye talks just because I'm such a big fan of it.
Awesome.
Well,
we're about to wrap up.
I'm going to do one shameless plug of my podcast, which Laura, you and I recorded. And so if you go to this website, Ocular Surface Academy, we have resources where Laura and I actually worked on patient handouts where you can explain what's wrong with you, what we're going to do about it. You can download them there. We do 20 episodes through each of the TFOS dues too. If you want to cut to the assessment diagnostics, take a look. Laura and I recorded a video way back, which has not published yet, but it's gonna. Okay. It's gonna be the one that's.
Is that the one where we were chatting about science and drinking wine together virtually?
Yes, we may have been a little candid. I'll let you edit it beforehand, but take a look.
Thank you. That's kind.
You can get the paperwork there, and you can subscribe. And thanks to this great meeting, I think it's a phenomenal event with all the
amazing job. Yep, and there's more to come. Stay tuned for the game show. It's I think at the end, and it'll be some good nerd humor and good nerd fun.
Yeah, and lastly, get yourself FireFly. I'll tell you, I'll put my personal reputation on it. You won't be sorry with it. You won't be sorry you got it.
Nice. Awesome. Thanks for joining me today. I can't wait to see you in person.
That'll happen.
Excellent. Have a good one.
Thank you.